Hello, my name is Tiara Noel, and I would like to thank you for joining me as I present my selected teaching strategy, which is virtual case studies. My passion for maternal and child care, combined with a deep commitment to improving patient safety, is what led me to choose virtual case studies for teaching the critical topic of postpartum preeclampsia. I truly believe that for high risk conditions like this, we need high fidelity scenario based learning to give our students the best preparation possible. So, what is case based learning? Case based learning is an active, student centered educational strategy that utilizes realistic clinical scenarios. By engaging directly with patient cases rather than passively receiving information, students take ownership of their learning. Case-based learning is also essential in healthcare education because it bridges theoretical knowledge with real-world practice, requiring students to apply what they know to clinical situations. This process is crucial for developing vital skills like problem solving and clinical reasoning, as students learn to assess information, prioritize, and make informed decisions to ensure patient care is delivered in a safe manner. Case-based learning also fosters critical thinking. It demands that students thoroughly analyze cases, consider multiple factors, anticipate potential complications, and justify their clinical decisions. This intensive analysis strengthens their ability to think like a professional nurse in complex healthcare settings. In my opinion, virtual simulation offers a safe, controlled environment for students to hone in on their critical judgment and practice skills without risk to real patients. It uses digitally delivered interactive scenarios that closely mirror actual clinical encounters. These simulations are highly realistic. They incorporate multimedia elements like images, videos, vital signs, and lab data. A key feature is the dynamic branching pathways, meaning the case evolves beyond the student's decisions. Students also receive immediate feedback on their choices at critical points, which enforces learning in real time. The CASE method, a discussion based pedagogy using real world scenarios, originated at the Harvard Business School in the 1920s. This established the groundwork for active learning strategies. It was not until decades later, during the 1960s and 70s, that McMaster University adopted and integrated case based formats into its problem based learning model. This was primarily to cultivate clinical reasoning and self directed learning in medical training. In the 1990s and 2000s, this time period marked a significant increase in the adoption of case based learning within the nursing programs around the United States. This was a response to the growing complexity of clinical practice and a need to better prepare students for real patient care challenges. Advancements occurred in the 2000s and 2010s, and then we saw an emergence of digital and web based patient simulations in health professions education, offering more interactive and accessible clinical learning tools. Currently, beginning in about the 2010s till now, virtual case studies have become a standard instructional strategy in nursing education. It is strongly supported by evidence from systematic reviews. The virtual case platform is designed to support diverse learning styles by offering visual learners the opportunity to engage with embedded patient charts, lab values, and clinical images directly within the case for optimal comprehension through sight. It also supports auditory learners by enhancing understanding and retention through voiceover narrations, discussion prompts, and structured debriefing conversations. Our readers and writers, it supports them by giving them opportunities to process information via text and writing through structured case notes, reflective journals, and written explanations of clinical decisions. are kinesthetic or hands-on learners. It allows them the opportunity to actively participate in clinical reasoning and intervention through simulated hands-on practice. This is usually facilitated by branching decision points and virtual clinical actions. Virtual case studies support the development of higher order thinking by incorporating patient data analysis, where students are allowed the opportunity to analyze real patient data, including vital signs, blood pressure trends, lab results, and symptoms. This is crucial for detecting abnormalities and identifying clinical patterns necessary for accurate diagnoses. It also supports clinical decision evaluations. Learners are required to evaluate clinical decisions by weighing risk factors, prioritizing nursing interventions, and justifying their clinical judgments with evidence-based rationale to ensure patient safety. Virtual case studies also help with care plan development. Students are expected to synthesize their comprehensive, individualized care strategies. This development involves integrating pharmacology, safety protocols, and patient education that is tailored to that specific patient or the specific needs of that patient. There are several things to consider when you're implementing virtual case studies. I have outlined some best practice techniques. One would be objective driven design, where you're aligning with your course objectives. Every case study element, including decision points and teaching moments, must be directly linked to measurable course learning outcomes to ensure focused development of targeted skills. You're also wanting to make sure that the case studies are authentic. So, clinical relevance and engagement based on authenticity is important. Based on all scenarios, on genuine clinical cases, and you want them to adhere to current evidence-based practice guidelines to maximize that student's engagement and practical relevance. Ensuring that evidence-based practice is embedded is very important. You would need to make sure you incorporate the latest clinical guidelines, such as those from ACOG or A1. Should be directly aligned with that case content to actively promote evidence-based nursing care. You also want them to progress in complexity, so either scaffold or unfold in nature. Employing an unfolding structure, beginning with less complex cases and gradually introducing increased clinical complexity and patient acuity to systematically build student competence and confidence is also important. You also want to make sure that they are facilitating learning. You want a structured debriefing to follow. So in this, you want to conduct structured, guided reflection sessions following the completion of each case to help students analyze their decisions, consolidate any new knowledge, and enhance clinical reasoning. One of the most important, last but not least, but you want to make sure that these virtual case studies support a psychologically safe environment. You want to establish a low risk, supportive learning environment. And this is going to encourage students to openly take risks, learn from their mistakes, and engage in honest self assessment without the fear of punitive judgment. Here is an example of a virtual case study I would implement in a maternal child nursing course directly related to postpartum preeclampsia. We would start this virtual case study with a pre-briefing where students would review her name is Maya in this particular case study. They would review Maya's patient history, her prenatal records, and her postpartum notes to understand the baseline health and risk before we engage into the case. The students would then enter to the case engagement phase where the student assesses vital sign trends, any labs such as your creatinine. You're looking for thrombocytopenia, any proteinuria. And the student would also assess any medication orders to gather key clinical data. This would then shift into our decision points where the student would make decisions and those decisions would have consequences. So, branching prompts would ask students to prioritize assessments, initiate interventions, notify the provider, and also administer IV magnesium sulfate safely in a safe manner. Once those decisions are made, then we would shift into an outcome assessment where the students would see real-time consequences of their decisions. So, for instance, if they delayed administration of magnesium sulfate, they may have an instance where the patient outcome involves that patient going into seizures. And this would give the opportunity to highlight any care impact based on those decisions. Following this, we would shift into our debriefing, where a facilitator-led debrief links clinical choices that student made to evidence-based guidelines. And this would encourage reflection and reinforcement of learning. Here's some data to support that virtual case studies have been found very beneficial in healthcare education. One study showed a 30% improvement in clinical reasoning. One showed an 85% increase in confidence for nurse practitioner students after 8 weeks of virtual case study use. And there have also been studies that validate that virtual clients being used as an effective clinical reasoning assessment tool is very appropriate. In fact, this research focused on confirming that virtual client scenarios can actually mimic the complex decision-making processes required in real-world clinical practice. This includes the ability to gather historical data, interpret diagnostic information, formulate hypotheses, and develop comprehensive management plans. So there are several ways we can assess student learning when it comes to virtual case studies. Some different formative assessment strategies could include in-case scoring and our immediate feedback. These options actually utilize decision point scoring within the case to provide instant automated feedback on that user's clinical decision making and rationales. We could consider post-case reflection being implemented. That is another formative assessment that we could incorporate that would encourage that student to become aware and self-evaluate through reflective journaling after completing the case study. We could also, which in our example, structured debriefing, that is definitely a formative assessment method that we could integrate. And that facilitates a structured question framework. So the student in debriefing could answer what happened. That would give that student an opportunity to analyze what happened in that situation based on decisions that they made. We could also ask, so what? So, what are the implications of some of those decisions that you made? And we can also include now what? What, based on those decisions, what do we do next? What would you do in the future? So it also ties in that reflective thought process along with debriefing. We also could incorporate some summative assessment components like a rubric, a clinical decision making rubric. So with this tool, we could evaluate the accuracy of assessment and their prioritization of interventions. We could also incorporate a knowledge assessment where learning gains are quantified through pre and post case knowledge tests. So we could introduce or incorporate a pre-test or a post-test. And then as far as self-regulation and professionalism, peer evaluations, that would be a good way to incorporate a summative assessment. We could also do a self-assessment tool where students foster professional growth and self-regulation. So overall, here are our key takeaways. Virtual case studies are an evidence-based approach in nursing education. They effectively bridge our theoretical knowledge with our clinical practice. And this method also supports a variety of learners. We discussed the multimodal engagement, which develops advanced clinical reasoning skills. Specifically, the example that I presented, the postpartum preeclampsia case, is designed to sharpen students' abilities in assessment, clinical judgment, and performing safe interventions. We're also going to include a structured debriefing and a comprehensive assessment. Those are ways to ensure that the students are prepared to transition into competent clinicians. Those are great ways we can incorporate some assessment interventions. I'd like to sincerely thank you for your time and attention during this presentation. And here's also the list of references utilized to develop and explain the teaching strategy that I chose for this project. Thank you.